Hi everyone, I'm Dr. Tirta Wijaya. Welcome to my channel where we will talk about various health matters, and today we will talk about diabetes. Diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin or when the pancreas can produce enough insulin but the body cannot use it effectively. Before going further, let me explain briefly some terms that we are going to use quite often in this video so you will understand what I'm talking about. Pancreas is an organ located in the upper left abdomen, tucked horizontally behind the lower half of the stomach. It is around 25 centimeters in length. It is shaped somewhat like a wedge, with the bigger end is called caput, means head, and the smaller end is called cauda, means tail. The middle part is called corpus, means body. The pancreas has two roles, one as part of the exocrine system, the other as part of the endocrine system. What are exocrine and endocrine? Okay, once food has been merged and partially digested by the stomach, it is pushed into the small intestine. The pancreas adds its own digestive juices and enzymes to the food. This is the exocrine role of the pancreas. The pancreas also produces the hormone insulin, which helps to control the amount of sugar in the blood. This is the endocrine role of the pancreas, which we will cover more in this video. Insulin is a hormone that regulates blood glucose, and glucose is one of the most simple type of sugars, and it is our body's preferred type source of energy. Other types of common sugars are fructose, sucrose, lactose, maltose, whatever. When we consume the other sugars, our body needs to convert them to glucose to be used. Hyperglycemia, composed from hyper, means high, and glycemia, means glucose in blood. So, hyperglycemia means raised blood glucose. It is a common effect of uncontrolled diabetes, and over time it leads to serious damages in our body, especially the nerves and blood vessels. Since 2000, global mortality rates from diabetes have been increasing. By contrast, in population aged 30 to 70 years old, between 2000 and 2019, there was 20% decrease globally in the probability of dying from any one of the four main non-communicable diseases, which are cardiovascular diseases, cancer, chronic respiratory diseases, or diabetes. There are different types of diabetes. In this video, we will focus on type 2 diabetes. I will describe the other types of diabetes briefly so we all know what are the differences between those types. Type 1 diabetes, or previously known as insulin-dependent juvenile or childhood onset diabetes, is characterized by deficient insulin production. People with type 1 diabetes requires daily administration of insulin because their pancreas does not produce enough insulin, if at all. In 2017, there were 9 million people with type 1 diabetes. The majority of them live in high-income countries. Up to now, the causes and thus the prevention of this condition are unknown. Type 2 diabetes happens when our body does not react to insulin properly. It affects how our body uses glucose for energy, and if not treated in time, it can lead to hyperglycemia, damaging nerves and blood vessels all over our body. This is the most common type of diabetes. More than 95% of people with diabetes have type 2 diabetes. This diabetes was formerly called non-insulin dependent because, in contrast to type 1 diabetes, which also known as insulin dependent diabetes, at the beginning, pancreas still produces insulin, often at elevated levels as the response of the insulin insensitivity. But over time, the pancreas is too overworked to keep the overhyped insulin production, so the insulin level drops accordingly. Type 2 diabetes was called adult onset diabetes 2 because This type of diabetes was seen only in adults, but now it is also occurring increasingly frequently in children. So we no longer differentiate type 1 and type 2 diabetes by age of onset anymore. Symptoms of type 2 diabetes are quite similar to type 1 diabetes, but are often much milder, progressing very gradually. As a result, many people are not aware of this in the beginning, and the disease often diagnosed several years after onset, after they are starting to suffer from the complication. Early diagnosis is important to prevent the worst complications of type 2 diabetes. The best way to detect diabetes early is to get regular checkups and blood tests with a healthcare provider. Type 2 diabetes is very preventable. Factors that contribute to developing type 2 diabetes include being overweight, sedentary lifestyle, that is fancy words for not enough physical activities, bad habits like staying up late and smoking, and genetics. Gestational diabetes is hyperglycemia with blood glucose values above normal but below those diagnostic of diabetes. Gestational diabetes occurs during pregnancy. Women with gestational diabetes are at an increased risk of complications during pregnancy and at delivery. These women and possibly their children are also at increased risk of type 2 diabetes in the future. Gestational diabetes is diagnosed through prenatal screening, not through reported symptoms. Impaired glucose tolerance (IGT) and impaired fasting glycemia (IFG) are intermediate conditions in the transition between normality and diabetes. People with IGT or IFG are at high risk of progressing to type 2 diabetes, although this is not inevitable. With proper management, the progression to full-fledged diabetes can still be reversed at this point. Symptoms of diabetes may occur suddenly. In type 2 diabetes, the symptoms can be very mild and may take many years to be noticed. Common examples of the symptoms are polydipsia, it means drinking more because of increased thirst. Polyphagia means eating more because of increased hunger. Polyuria means urinating more often than usual. Blurred vision, feeling tired, losing weight unintentionally, and paresthesia or numbness sensation on feet and hands, often referred as socks and glove neuropathy, because people experience reduced feeling on hands and feet as if they are wearing socks and gloves. As you can see, these symptoms are not specific and easily be confused with other conditions. Therefore, regular checkup and blood tests are very important to detect diabetes early, long before the condition progresses and develop complications. Over time, diabetes can damage nerves and blood vessels in the heart, eyes, kidneys, and all over our body. People with diabetes have a higher risk of health problems, including heart attack, stroke, and kidney failure. The first diabetes patient I encountered as a medical student was a middle-aged man who was dragged by his wife to the hospital due to erectile dysfunction caused by his uncontrolled type 2 diabetes. Diabetes can cause permanent vision loss by damaging blood vessels in the eyes. This damage is irreversible. We can only try to slow or stop the progression, but up to now there is no known treatment to restore the vision loss in diabetic retinopathy. It is the leading cause of blindness in the world. Many people with diabetes develop problems with their feet from nerve damage and poor blood flow. Paresthesia in sock and glove neuropathy compromises their ability to detect feet injury early because they simply cannot feel, and it delays proper treatment of the wound and complicates the wound healing process. All this can cause foot ulcers and may lead to amputation. Next, we will learn how to diagnose, treat, and prevent diabetes. If you have questions about this topic or other health-related topics, you can ask by typing your question in the comment section below to be discussed in my next videos. But please, do not consult your specific conditions. This is my disclaimer. If you like this kind of content, kindly like this video. It is a great encouragement for me. You can also help and support me to keep on producing contents you like by subscribing to this channel. How to prevent diabetes? Lifestyle changes are the best way to prevent or delay the onset of type 2 diabetes. To help prevent type 2 diabetes and its complication, people should apply healthy lifestyle by reaching and keeping a healthy body weight. How healthy is healthy body weight? Well, you can use BMI or body mass index as a guide. It is not perfect, but it is useful as a guide and easy to use. Number 2, by staying physically active with at least 150 minutes of moderate exercise each week. Low intensity exercise is not effective enough, while high intensity exercises comes with their inherent risk. Number 3, by eating a healthy balanced diet with more fresh vegetable and fruits and avoid sugar and saturated fat. Number 4, stop smoking, whether as an active or passive smoker. It will be great to stop other bad habits as well, like drinking alcohol, abusing drugs, etc., as part of healthy lifestyle. Number 5, by getting high quality and adequate quantity of rest by practicing good sleep hygiene. Even partial sleep deprivation over one night increases insulin resistance, which can in turn increase blood glucose level. As a result, a lack of sleep has been associated with diabetes. And last but not least, by managing our emotional stress. Many people do not realize that emotional stress can trigger hormone secretion that increases the blood glucose level. Chronic emotional stress can lead or worsen existing diabetes in the long run. The healthy lifestyle is not only for people with diabetes who want to prevent the progression of the disease and its complication. It is for everyone with or without diabetes. Early diagnosis can be accomplished through relatively inexpensive testing of blood glucose. People are advised to start routine health screening annually by the age of 30, even when they do not show any sign or symptoms. The health screening can be done earlier or more frequently, or both, for people with risk factors. One of the most important ways to treat diabetes is to keep a healthy lifestyle, as I mentioned earlier in this video. For people with impaired glucose tolerance and impaired testing glycemia, applying healthy lifestyle alone often enough to stop or even reverse the progression to diabetes. Some people with type 2 diabetes will need to take medicines to help manage their blood glucose level, in addition to practicing healthy lifestyle. Some examples of the medicine include metformin, sulfonylureas, sodium glucose co-transporter type 2 inhibitors, and insulin injection. For people with type 1 diabetes, insulin injection is a must in order to stay alive. Along with medicine to lower blood glucose, people with diabetes often need medication to lower their blood pressure and statins to reduce the risk of complications. Continuous glucose monitoring is nice to have for people living with diabetes, but the cheap needle prick glucose testing can do the job as well. And then, additional medical care may be needed to treat the effects of diabetes, such as foot care to treat the foot ulcer, screening and treatment for kidney diseases, and eye exams to screen for retinopathy, which causes blindness. That is my sharing about diabetes for today. I hope you find this information useful and beneficial. Please remember to like this video and subscribe to this channel to get more content like this. See you in the next video. Stay healthy and happy.